A woman was attending Pilates class when she suddenly felt a pop on the left side of her neck while performing one of the maneuvers. An hour later, she developed a headache, so she laid down to rest and the pain from her headache subsided. However, with each passing day, her headache gradually worsened, prompting her to make an appointment with her doctor's office. Suspecting a muscle injury, her doctor prescribed a pain medication, muscle relaxer, and therapy for neck manipulation. Despite her doctor's best effort, the headache persisted after weeks of therapy and multiple visits to the doctor's office, including a trip to the emergency room. She showed no signs of improvement with her headache, and by the fourth week, her headache was so debilitating she was unable to carry out her normal daily tasks. She then sought further medical attention at the nearby hospital and was admitted for further evaluation. The woman disclosed to the doctors about feeling a strange popping sensation during one of her Pilates sessions, just an hour before her headache started. The doctors noted that she had no history of migraines or recent injuries to her head. A CT of her brain was performed, and when doctors examined it, she was found to have a subdural hematoma, which is a collection of blood between her brain and the covering around her brain called the dura mater. The doctors also noticed that there was downward displacement of her brain, so they obtained a subsequent MRI, which showed leakage of cerebrospinal fluid in her spine. Cerebrospinal fluid, commonly referred to as CSF, is the fluid surrounding the brain and spinal cord. It helps with regulation and acts as a cushion from direct trauma. She had what's known as spontaneous intracranial hypotension, which is commonly caused by CSF leakage. These leakages can cause downward displacement of the brain, which then pulls it further away from the covering. This tension causes the veins found between the two structures to rupture, which then leads to complications such as a subdural hematoma. Causes of CSF leakages include lumbar puncture, epidurals, head injuries, and bone spurs. In the case of the woman, doctors speculated that she might have incurred minor trauma from performing strenuous activities during one of her Pilates class. This led to a tear in the covering around her brain. Treatments include conservative therapy such as bed rest, NSAIDs, and caffeinated drinks. However, recurrent CSF leakages can require more invasive interventions such as blood patches, and in more severe cases, surgery. In the woman's case, she received conservative treatment, and 1 month later, follow-up imaging revealed a normal-appearing brain and spine.